A very good afternoon to one and all. Today I would be talking on another Alleviate webinar series. My name is Dr. Khaja Javed Khan. I'm a pain management physician at Alleviate Pain Management Clinic, Bangalore. So today's topic is going to be an interesting topic. It's titled as A Journey Towards Pain-Free Knees. So let me take you on this journey towards pain-free knees. So we'll be starting off this presentation. This would be done under the following headings: introduction, understanding risk factors for knee pain, the anatomy of the knee joint, causes for knee pain, investigations, treatment, a bit about pain medicine and what it is all about, and finally the conclusion. Right, so let's come to the introduction part. So here we can see a cartoon over here, and we are seeing that the doctor is, telling to the patient that, be careful and be kind to your knees. You will need them as you get older. So what is the underlying message in this cartoon over here is we need to start taking care of our knees from a younger age itself, so that we don't suffer from problems later, like problems like degeneration, osteoarthritis, etc. If we are good to our knees are going to be good to us as we age, right? So moving ahead, let's have a look at the risk factors. What could be causing the knee pain? One is age. As we all know, as and when we get older, the knee problems are one of the most common joint problems which start off. Why? Because of simple wear and tear. As and when you are growing older, the bones and the cartilages are going to keep getting, undergoing a change. That is the wear and tear. This is called degeneration or osteoarthritis in our medical terminologies. And remember, knee joints are the one which are the most strained joints in our body. Since young age till the older age, we have been using our knees and they have been bearing the brunt of the weight, right? And they undergo the wear and tear. Other is females. Knee problems are seen to be more common in females compared to males. One factor could be the postmenopausal osteoporosis. As in, when a female is reaching their menopause, they there starts a change called as osteoporosis. In osteoporosis, the calcium from the bones starts getting removed and the bones become brittle and they tend to develop the problems. Obesity is a very huge risk factor, not only for various cardiovascular diseases or other diseases affecting the body, to even knee problems as well. The knee joint takes up most of the weight when we are in the standing posture. And as per studies, even 1 kg of weight gain can add up to 5 times that much amount of stress on the knee joints. So yes, people who come in to the OPD with knee problems, most of them are having the obesity issues. Next is low calcium and vitamin D. Calcium and vitamin D are very vital for our bone health, and any decrease in either of them can lead to bone problems and knee pain subsequently. Any history of previous knee injury? If anyone has had a fracture or a ligament tear, then it kind of compromises their knee. The posture, the way they walk, the way they stand is all affected, and it ends up laying extra stress over the knee joint. So let's have a look at the anatomy of the knee joint. What we are seeing over here, we take a pointer, is we are seeing over here the human knee, right? This is called as the thigh bone or the femur, and this is called the tibia. It goes down along with the fibula. We are having the ligaments around the medial collateral, lateral collateral. We have the meniscus. We have the cruciates over here as well. This white part, what you are seeing over here, is nothing but the cartilage. This part, what you are seeing over here, no, this white part, this is the cartilage. Now the cartilage is very important because this is the one which acts as a cushion in between the two bony structures of components of the knee joint, and these cartilage is the one which undergoes the age related wear and tear, and it is going to develop the osteoarthritis. Let me clear this. Okay, let's go back. Now, let's have a look at the causes for knee pain. Injury to the knee. One of the most common causes for knee pain is a fall. Any injury, anytime you have twisted your knee or you've fallen down or you've banged your knee somewhere, it's going to cause pain. Any inflamed tendon. Usually what happens is people, sometimes not just knee injuries, but people suffering from arthritis, right? They can develop certain tendinopathies, which can lead to knee pain. And other very important cause is, whenever there is the inflammation or arthritis, they can be diffuse fluffy swelling around the knee joint, and it can result in pain. Now, as you're seeing in this cartoon, what is being seen over here is, there is a lot of fluid inside the knee.
Doctor, I got disconnected from internet.
Okay, right. So let me go ahead with the presentation. Over here, we are seeing in this cartoon, the results have just come in. It appears you have water inside the knee. Well, water inside the knee, I mean, the patient seems alarmed, but it is a very common entity in patients suffering from osteoarthritis and any injuries or inflammation. The knee has potential spaces, right, wherein water can accumulate, and it can result in such conditions. Other is arthritis. Arthritis in India, almost 40 to 45% of incidents. That means 1 in 2 to 3 people suffer from arthritis, especially the degenerative osteoarthritis, and they end up living with knee pain for long periods of time. So let's have a look at the different kinds of arthritis. One is called as rheumatoid arthritis, right? So again, rheumatoid arthritis. So rheumatoid arthritis, what we can see over here is this is a healthy joint, and this is a joint which is affected with rheumatoid arthritis. So remember, rheumatoid arthritis commonly occurs in the younger age group, and this is where the body's immune system, it develops an inflammation, and it starts eating away its own healthy cartilage. So what we are seeing over here is, there is a lot of degeneration. This is a reduced joint space over here compared to this one. And then we are seeing a lot of bone erosions over here, right? There is swollen or inflamed synovial membrane. So this is the reason why, there is a lot of pain and happening. This red thing, what you're seeing over here, this is the one which is going to cause a lot of inflammation and severe amount of pain and swelling of the knee joint. Other thing over here, what we are seeing over here is, the cartilage also is going to wear away, and this is going to develop a lot of wear and tear compared to this, which is a totally normal structure, right? Okay, so moving ahead, this is how rheumatoid arthritic knee looks, very red and swollen. Rheumatoid arthritis can affect the other joints as well. Okay, could be the elbow, wrist. Commonly, rheumatoid arthritis is seen in the small joints of the extremities like hands and the legs. Next is osteoarthritis. As you can see, this is a healthy knee, this is an unhealthy knee joint. So what happens in osteoarthritis? Let me annotate this again. Over here, more than the inflammation, it is the cartilage which is beginning to break down. You can see over here that, there is a lot of wear and tear happening. You can see these cracks which are developing within over here. The cracks developing over here, these are the ones, and the reduced joint space in the meniscus as well. So the meniscus also starts eroding, and a lot of bone spurs happen, and the cartilage, which was normal over here, you can see over here, it has developed wear and tear, right? This is about osteoarthritis. There are many stages in osteoarthritis. To name, there are about 4 stages, 1, 2, 3, and 4. And as you can see, this is mild, This is moderate, this is severe, and this is very severe, wherein there is a bone-on-bone condition. Right. Moving ahead, let's have a look at a few investigations. Whenever you visit a pain management clinic or an OPD with knee pain, what are the common investigations which are asked? One is blood tests. Blood tests are done to rule out if there is any inflammation in your body, to check the calcium and vitamin D levels, to check the ESR and the CRP. Now, this is an X-ray, what we are seeing over here. And you are seeing that, this is a normal joint. Let me annotate this a bit. Okay. So this is a normal joint, what you're seeing over here, right? You can see that there is normal bones and normal joint space as well. Let me compare this with osteoarthritis. What are you seeing over here? One is the bones are all osteoporotic. You can see that the joint space second is reduced over here as well compared to this. And then the basic symmetry of the bone, you can see over here, these are all bone spurs, what you're seeing, whereas this bone is clean, right? Now, ultrasound, commonly in the previous slide, I was talking about water inside the knee. So these kind of fluid-filled things, spaces can be identified better with the ultrasound. And ultrasound is used not only for diagnosis, but for doing the treatment as well. MRI, usually done whenever patients suffer from knee ligament tears or injuries. Now, let's move ahead and have a look at the treatment. So treatment, conservative, we have to always start first with the conservative treatment, and weight loss is one of the most important thing, which is in the treatment strategy. So anyone at any stage of osteoarthritis, if there is increased weight, you have to always think of weight loss. Diet, primary diet is very much important. Remember, if you want to do weight loss, diet is going to constitute 80 to 85% of it, and then exercise another 10%, and 5% is going to be sleep and your mental well-being. So diet rich in calcium and vitamin D and healthy green leafy vegetables is what is important. So there are foods which, these are the foods which help fight inflammation: fish, fruits like berries, prunes, yogurt, haldi or turmeric, and then spinach, whole grains. Supplements like omega-3 fatty acids are very important. Calcium-rich foods are these which I've enumerated: almonds, soy, beans, fish, broccoli, orange, dairy products are all rich in calcium. Vitamin D, these are the 10 best vitamin D rich foods. We have sunlight. Well, sunlight is the best source of vitamin D, we all know. Then we have egg yolk, mushrooms, fish, cheese, cod liver oils, orange juice, cereals, etc. Now, exercises, they constitute to be a very important part of our management. Walking is the best form of exercise. Try to dedicate half an hour every day for walking, okay? And this is definitely going to help strengthen the muscles as well. Knee strengthening exercises also play a very vital role. I usually advise my patients to, do the knee strengthening exercises. I teach them along with the physiotherapist with me, and these exercises are told to the patient to be done every day for at least 15 to 20 minutes. These are the knee strengthening exercises, what you're seeing. Strengthening all the muscles, proximal and distal to the knee joint. Medications, of course, medications also have a role, usually in the acute stage of the disease. NSAIDs, anti-inflammatories help reduce the inflammation and decrease the pain. Once the age increases and it's a degenerative condition, that time it is not so safe to continue using the medications, but use other modalities as well. Surgery is usually recommended for grade 4 osteoarthritis, wherein the bone is on the bone, and usually the patients have suffered a lot, and they are in the last stage of the osteoarthritis, and for them knee replacement surgery is what is best. Now, what is done over here is different components are removed and they are replaced. So a lot of patients come to me who have reached to the stage where surgery has to be done or been suffering from knee pain due to different causes, and they ask, are there any different options or alternatives? Well, yes, now with the advance of medical science, we do have different options and alternatives. And yes, it's a big yes. And pain medicine is one such branch of medicine which gives you a lot of options. So, what is pain medicine? Still, a lot of people are not aware of what this beautiful branch of medicine is. So, it's a super specialty branch like cardiology, neurology, etc. If you suffer from heart problems, you visit a cardiologist. If you suffer from diabetes, you visit a diabetologist. Similar to that, if you suffer from pains, you have to visit a pain management specialist. So the field of pain medicine is a branch of medicine which deals with treatment of chronic pain conditions. Many of the doctors themselves are not aware of this branch of medicine. So what do we do in pain medicine? Usually we do interventions to stop the pain. So as you're seeing over here, these are the various grades of osteoarthritis. And usually for the early stages, like, doubtful, mild to moderate stages, we use regenerative treatment options. One of the regenerative treatment options is something called as PRP, or platelet-rich plasma. Remember, the blood contains three components: RBC, WBC, and platelets. RBCs make the blood red. WBCs give us immunity, and platelets are the ones which are going to help in regeneration and repair. So what we do is we take patient's blood, separate the platelet fraction of it, and inject it inside the knee joint if there is osteoarthritis, or into the ligaments if there is any kind of a pain, right? So this is what is the platelet-rich plasma, what we're going to get after separation. Visco or gel injections are also used. They help in lubricating the knee joint and improving flexibility, and helps in mobility and walking. This is me doing the knee PRP intervention under ultrasound guidance to a patient who had relatively mild to moderate osteoarthritis. Remember, the PRPs are going to help save your cartilages and delay the onset of osteoarthritis. This is using X-ray machine, me doing the PRP intervention. As you're seeing over here, this is the knee joint, and then the needle, and then inside the knee joint, the PRP and visco being injected. So for patients who are in the last stage of osteoarthritis, as I had explained, there is cartilage loss, joint space narrowing. For them, there is definitely hope. A lot of people might not be in a position to undergo knee replacement surgeries, either because of their age, or the heart related, or different comorbidities, or the patient themselves not willing to undergo such a high magnitude procedure. So for them, definitely there is hope. One of the hope is something called as radiofrequency ablation. What happens in radiofrequency ablation is we target the painful nerves around the knee joints, create a lesion, create a sophisticated lesion, and then ablate or block those nerves. So this is me doing RFA to a patient using X-ray guidance. This is with the ultrasound guidance over here. And this is a video. So what we're seeing, this video over here is we are seeing that, this is the vein. This is a Doppler, and then in an ultrasound, you're going to see the genicular artery. Sorry, not the vein, it's the genicular artery, and this is the target around which the nerve will be there, and we'll be using this for lesioning, for the radiofrequency ablation. Now, this over here, you're going to see a cool radiofrequency ablation, and you can see the pulsatile artery in this video. As we are seeing in this video, there is a pulsatile artery, and this is the needle, and we're going to start the lesioning. So what are the advantages of all of these pain management interventions? Remember, they're all daycare, right? And the patient can get back to work as quickly as possible. There's no need for you to be in prolonged bed rest. Of course, there's no surgery we are doing over here. Everything is done under image guidance using local anesthesia, and thereby decrease the number of complications as well. It's a simple prick for a patient, the interventions, but it is technically challenging for the doctor. Fine. To conclude, I would say that knee pain is very common. The notion that a lot of patients tell that, I have to live with the pain, I have to bear with the pain, is a totally wrong notion. Pain is something which needs to be taken care of, and especially knee pain, which is very common in our Indian population. We need to make sure that we are aware of the different options which we are having, and we need to make people aware, the people around us aware of the various pain management interventions which are there, so that people can live a pain-free life. Thank you very much. I would be ending my presentation at this note.